Hello, I will talk now about autoimmune diseases and endometriosis, and I'll try to address this possible relationship through three main questions. The first question is endometriosis at least partly an autoimmune disease? The second question is, do typical autoimmune disease in some way contribute to the development and maintenance of endometriosis? And the third question is, can we treat endometriosis with some kind of immune system modulators? There is plenty of evidence that endometriosis is linked to some disturbance in the immune system. There are many changes observed in the immune cells, including circulating cells and also peritoneal immune cells in women with endometriosis. And these include an alteration in the function of macrophages. Macrophages in endometriosis become less active and less effective to clear debris from menstrual blood reflow. And as a consequence of this failure of macrophages to activate the defense mechanism against these ectopic cells in the peritoneum, they manage to attach and to grow in ectopic sites. So the first phase of endometriosis has an immune system disturbance that's mainly characterized by a low and insufficient immune response to the presence of an exchange, an outsider cell that comes from retrograde menstruation. And then in a second moment, when the disease is already established, then what we see is an abnormal increase of immune and inflammatory reactions that perpetuate the disease development and symptoms. As regards mediators of the immune response, some have been found increased or decreased in blood of women with endometriosis. And here is an example of an antibody that reacts against the granulocyte and macrophage colon stimulating factor. This antibody is found in blood samples of women with endometriosis in a very higher amounts compared with healthy controls, in this case, blood donors. And this substance that is a kind of a cytokine that communicates information between immune system cells. This is released by macrophages, but also acts back on macrophages and stimulates these cells, the macrophages, the activated macrophages, to produce other products that by their turn activate mast cells and degranulate for example, histamine and activate allergic response. Other products activated by macrophages are able to promote the growth of the endometriotic implants. And as these implants grow, they produce other immune system signaling molecules like cytokines and chemokines, which recruit novel cells, other cells, to the site of inflammation and further activate macrophages, creating a vicious circle. Other examples of immune cells, substances, and products that are released in endometriosis, we can see here demonstration that CD200 is increased in the endometriosis and is further increased by estradiol stimulation. So estrogen promotes a further increase in CD200 that inhibits the phagocytotic activity of macrophages, and this will facilitate the survival of endometriotic implants in the peritoneum. And after their survival, they can attach and invade the peritoneum. So these dysfunctional macrophages, they fail to clear up the endometrial debris in the peritoneum, and this is a starting point to the development of endometriosis. Another abnormality in the immune system that has been found in endometriosis is the presence of anti-endometrial antibodies in blood plasma of women with endometriosis. As this picture shows, there are both IgM and IgG detectable by Western blot, and also with immunohistochemistry. This is immunohistochemistry performed upon endometrial samples with serum from women with endometriosis instead of an animal-resident serum. And this serum from patients contains antibodies against the endometrium itself. So these autoantibodies are present in association with the disease. And there are also some gene polymorphisms that are related to autoimmune and the immunoregulatory mechanisms. And these gene polymorphisms have been found abnormally altered, abnormally distributed in women with endometriosis compared to a control population. So for the first question, endometriosis is associated with many abnormalities in the immune response. Some of them may increase autoimmunity. Endometriosis patients have anti-endometrial and anti-GM-CSF antibodies, and endometriosis is associated with gene polymorphisms possibly affecting autoimmunity. So let's move to the possible clinical association between endometriosis and autoimmune disease. This is a recent meta-analysis after a careful systematic review that upon thousands of records and dozens of studies evaluated, identified only 4 studies with high quality evidence of the association between endometriosis and some autoimmune disease. So these are the 4 studies. The first one correlated the presence of endometriosis with an increased risk of lupus and arthritis rheumatoid arthritis. This was based on only a few cases. You see here 16 cases of lupus and 53 cases of rheumatoid arthritis over almost 200,000 patient years followed up in this important cohort study, the Nurses' Health Study too. So even if this is based on a very, very low incidence of autoimmune diseases, they were more prevalent in endometriosis patients than in the matched controls. And the risk ratio was about 2 for lupus and 1.4 for rheumatoid arthritis. This is based on a Danish cohort, very large study also, and found an increased risk of multiple sclerosis, but only 1.3 of relative risk. An increased risk of systemic lupus erythematosus, this is 3.4 increase, and also Sjögren's syndrome, 2.1. This is not a huge risk and is not present in all age segments, but it's statistically significant because it's based on a large number of people, of patient years. And finally, there is another study based on a Danish cohort based on 11,000 women with celiac disease that show that this type of autoimmune disease is more prevalent among women with endometriosis, but the risk increase is about 1.4. Also in bowel disease, this is inflammatory bowel disease, and we have a kind of 1.3, 1.6 increase of ulcerative colitis among women with endometriosis, and 1.3 of Crohn's disease. Another recent and very interesting study from the Milan group showed that in women with endometriosis, the coexistence of autoimmunity is associated with a more severe form of endometriosis with a higher number of laparoscopies performed and a more advanced stage according to ASRM score. But pay attention, because this is all evidence of association between endometriosis and autoimmune disease. And as we know very well, association does not mean causation. So In another attempt to explore the possible cause-effect relationship between endometriosis and autoimmune diseases, a group from the Bateau laboratory at Cochin Institute, first author is Marine Pinot, and this group studied what's the relationship between thyroid disimmunity and thyroid hormones in endometriosis. In this very impressive series of experiments, the first evidence was that endometriosis cells do have receptors for thyroid hormones, as this figure shows. And when you culture endometriosis cells with TSH, you have an increase in cell proliferation, as well as you see the same increase in control endometrial cells. But when you culture them with thyroxine and also with T3, you have an increased proliferation of endometriotic cells, cells derived from endometriotic lesions, but not in normal endometrial cells. So this next step was to perform 3 models of thyroid disease in mice. The first model was hypothyroidism with toxic destruction of thyroid cells, and is characterized by low thyroid hormones and high TSH without autoantibodies. The second model is that of autoimmune thyroiditis with an increase, a transient increase in thyroid hormones, a transient decrease in TSH, and an increase in autoantibodies. That's similar to what happens in the first phase of Hashimoto disease, for example. And then an immunization against thyroglobulin with normal thyroidism and increased antibodies. So which is the villain? Which is the culprit for the association of endometriosis and thyroid disease? Is it thyroid hormones that increase either transiently or permanently? Is TSH or thyroid autoantibodies? And what this experiment showed was that when you perform a model of hypothyroidism on the left, you reduce the growth of endometriotic lesions. When you perform a model of autoimmune thyroiditis with increased thyroid hormone levels, you boost the growth of endometriotic lesions in this experimental model. And when you perform an immunization with high antibody titers, but without an increase in thyroid hormones, you do not have any important effect. So this experiment very elegantly clarifies that in autoimmune thyroid disease, what effectively stimulates the rise, the progression, the growth of endometriosis is the increase in thyroid hormones themselves and not the antibodies. So the answers are, yes, endometriosis is associated with a modestly increased risk of autoimmune disease. The mechanisms are mostly unknown, and thyroid hormones rather than thyroid autoantibodies contribute to the endometriosis growth. And to close, I'll show 2 studies about immune cell modulation or interventions on the immune system and what they do in animal models of endometriosis. In this first study, also from Bateau laboratory, what was done was to compare 2 models of B lymphocyte modulation or ablation. The first is with an antibody that ablates B lymphocytes, and the first is with a modulator ibrutinib that just reduces the activity of B lymphocytes. And you can already see in this picture that with ibrutinib, the implants grow slower and they are smaller than with control treatment or with anti-lymphocyte antibody. So what this experiment shows is that B-cell inactivation, rather than B-cell ablation, is able to reduce the inflammatory environment of endometriotic lesions and thus stop or reduce the rhythm of endometriosis growth. This important study also recently published by the same group from Frédéric Bateau clarified what is the role of macrophages in the initial development of endometriosis. What was done was to train macrophages with low doses of LPS, it's a bacterial antigen, and then modify their profile of cytokine and chemokine production. And what resulted from this experiment was that with LPS, the production of local chemokines like and chemokine receptors like CCR2, etc., was very much abrogated. And the result was that endometriotic lesions growed very less compared to controls and much less compared to the opposite, that was the activation of macrophages with BCG antigen. So it's also possible to modulate the growth of endometriotic lesions by interfering with the immune system. And to end, I would say that B-cell inactivation and macrophage training can reduce endometriosis growth in mice. But I would like to stress that according to this review by authorities in the field, like Taylor and Thomas de Rouge, immunomodulatory drugs for endometriosis treatment are not available at present. They are being studied, but they are not already available. And new candidate drugs should be first tested in the baboon model soon after the rodent model, before arriving to the human tests in a pilot study in a few symptomatic women. But we do not, we should not we should not consider likelihood that these immunomodulator drugs will be effective on deep or fibrotic disease or large ovarian cysts because of the action mechanisms that will favor much more superficial initial phase disease rather than old, established, and fibrotic endometriotic lesions. That's all, and thank you for your attention.